At 8:30, though, in our Health Watch, a simple test or two could save your life. So every Monday this month, we're motivating you to be more proactive about your heart health. And so this morning, joining us is MedStar Dr. Alan Taylor. Good to see you, Doctor. Thanks for joining us.
Good morning, Steve. Thanks for having me.
So listen, we say a simple test, right? To me, as somebody who tries to avoid you, no offense, it doesn't sound like a simple test. So let's talk about some of the tests that are available, what they entail, and how they can help us. Do you want me to just throw some out, and then you can tell us like what they're all about?
Yeah, let's go for it.
All right, so let's start with the first test that we have, I guess, would be an arteriogram. What is that?
Arteriogram, complicated test, catheters inside your body, assessing the arteries, something we do for patients with symptoms, but not in a screening sort of way.
Okay, so maybe I shouldn't have started with the complex one. We said we would do simple ones. Coronary calcium scanning, what is this?
There we go. Now you're onto something. So a calcium scan is what you're seeing over my shoulder. It's a simple CAT scan, an X-ray test, no special preparation, takes a few minutes, and it's a look inside of you. It's a look inside to see how much buildups you've developed over your years. We think men and women 50 to 60 years old are a perfect age for this when they can start taking proactive steps on their heart health. And it's the adage, Steve, of a picture says a picture's worth 1,000 words. And you see these buildups in the arteries, you see these white things you see over my shoulder. And that's a sign that's really a sign of how your arteries are aging.
So let me ask you this, doctor, because obviously there's a number of tests that we could go down. I'll just yield to your expertise here. If I come in, for example, and I say, listen, I'm getting to that age, I want to be screened, I want to make sure that I'm heart healthy. What do you tell me first, or where do we go first with this series of tests?
Yeah, so first thing, we'll measure your cholesterol, your blood pressure, but then this test really adds to that because it tells us, okay, what's actually happening inside of you? And it's really no way to tell what's happening inside of you. This develops without symptoms over decades. It starts in your 30s, and by the time you're in your 50s, 60s, this is reaching a critical level. And to know knowledge is power, and to know this can lead to lifestyle changes, the right medications, and just simply being proactive. And so whereas we used to do stress tests to screen, this is a better screening method. And the guidelines, our literature really supports that this test, just like you get your PSA checked or you get your mammogram, you want to know what's happening inside. This is the way to know what's happening inside with your heart and your arteries.
Yeah, absolutely. Listen, for a viewer that might be saying, I'm watching it right now, and I've been putting this off, maybe I should do it. When you consider whether it's this test or something else, if it's not a patient you're necessarily familiar with, do you look at things like family history, hereditary factors, lifestyle? What is it that, I guess, would steer you towards somebody maybe having a test versus not?
Right. So the first thing is simply age, because we're all living in an environment of too high cholesterol, we always could be more physically active. Diet should be optimized. But age alone is the best thing because, think of this, 1 in 2 men and 1 in 3 women in their lifetime will develop cardiovascular disease. So it's so common, and the risk factors give us a starting point. But until you look inside, you don't know. And this test is inexpensive, very fast, no needles, no anything like that. It's just a simple boop, scan, and you're done. So this is the single best test to determine, in addition to your risk factor measures, your cholesterol, blood pressure, if you really are developing artery disease at a rate faster than we think is helpful, is safe.
Sure. And then I'm assuming from the results of that test, then you've got multiple other tests that you can go in whatever direction you need to go.
Yeah, we often wouldn't do a lot of testing after this. It's just simply optimizing risk, advising on lifestyle, making sure blood pressure is perfect, cholesterol is perfect, and also being proactive in knowledge. And here's the other good side to this. You see this one area here with no calcium. There's nothing in this scan. You're good to go. You're on the side of things it's not developing artery disease. And that can be tremendously liberating. Many patients are reassured. And seeing these pictures can be very motivational.
The last thing for you, and we're going to have to wrap things up, but I do want to ask, because a lot of people, the reason that they don't come to see the doctor is they feel like, look, if the doctor says something's bad, it might be game over for me. If you do pull up through these screenings that, maybe you're not perfect, but some of these things, I'm guessing, through lifestyle changes could be correctable, right?
Oh, tremendously. It's never too late to start on the right path, right lifestyle, right medication. So this is knowledge is power. A picture's worth 1,000 words. And if you want to get your loved one something simple for Valentine's Day, great idea.
All right. I love it. All right. Thank you so much for your help. It's good talking to you this morning,
Thank
MedStar.
you.
You got it. MedStar Health Dr. Alan Taylor. Thank you so very much.